Good morning. Thank you all for being here. I'm happy to be joined this morning by Supervisor from District 10, Shimon Walton, and our new Director of the Department of Public Health, Dr. Grant Colfax. Also here are the people from my office who have been working tirelessly to help protect another generation of San Francisco youth from becoming addicted to e-cigarettes. That work has been led by my Chief Assistant, Jesse Smith, my Chief Deputy, Ron Flynn, our Chief of Complex and Affirmative Litigation, Yvonne Murray, Chief of Strategic Advocacy, Sarah Eisenberg, and Deputy City Attorney Ann Pearson, and Deputy City Attorney Neha Gupta. In December, the U.S. Surgeon General Jerome Adams issued a warning about what he termed the epidemic of youth e-cigarette use. The Surgeon General called this surge in e-cigarette use by children a cause of great concern. His message was clear: know the risks, take action, protect our kids. He was absolutely correct, and we're heeding that warning. Today, we are taking action to protect our young people. The steps we are taking are necessary and all the more urgent because another arm of the federal government has failed to do its job. The Food and Drug Administration is the entity responsible for reviewing new tobacco products to determine whether they are appropriate for the protection of public health. By law, before a new tobacco product goes to market, the FDA is supposed to conduct a review to evaluate the risks and benefits of the product on the population as a whole. That's common sense. If the FDA determines that the tobacco product poses a threat to public health, it should never hit the shelves. Inexplicably, in the case of e-cigarettes, that has not happened, despite the fact that in 2016, the FDA deemed e-cigarettes a tobacco product subject to the agency's jurisdiction. These products are on the street, even though the required pre-market reviews have never been done. In fact, the FDA has given the e-cigarette industry a pass. For no clear reason, the FDA has given these nicotine companies until 2022 to apply for what was supposed to be a pre-market review. The result is that millions of children are already addicted to e-cigarettes, and millions more will follow if we don't act. Until recently, we had made great strides in reducing youth tobacco use. The percentage of middle and high school students using tobacco products was at an all-time low in 2017. There had been a generation of success. Kids were getting off of nicotine after years of insidious tactics by the tobacco industry. But last year, according to the Center for Disease Control and Prevention, tobacco use among youth rose for the first time since the 1990s. This dramatic reversal, which erased our hard-won gains, is directly attributable to the nationwide surge in e-cigarette use by adolescents. In 2018, the number of middle and high school students who reported being current users of tobacco products increased 36%. 4.9 million American students reported they were using tobacco products last year, up from 3.6 million students in 2017. And use of e-cigarettes increased by 78% for high school students and 48% for middle school students. Think about that. Nearly 5 million American children were using tobacco products last year. That's a generation of kids, addicted kids, facing lung cancer and heart disease. Thousands of them will likely die of preventable diseases if we don't act. And that's not hyperbole. Tobacco use is the leading cause of preventable disease and death in the United States. Tobacco kills more than 480,000 people a year in this country. That's more than AIDS, alcohol, car accidents, illegal drugs, murders, and suicides combined. That is why we're acting now to reverse the tide of e-cigarettes. These companies may hide behind the veneer of harm reduction, but let's be clear. Their product is addiction. They are in the business of getting people addicted or keeping them addicted. A relatively small number of adults may switch their nicotine delivery system from traditional cigarettes to electronic ones, which may or may not be as harmful, but they are still harmful, and it is not an excuse to turn another generation of kids into addicts. Now it's up to local governments like San Francisco to protect our children. And today we're announcing that we are taking 4 concrete steps. First, San Francisco, along with the city of Chicago and the city of New York, sent a letter to the FDA this morning that demands that the FDA do its job. We are jointly telling the FDA to immediately conduct the required public health review of e-cigarettes that, by law, was supposed to happen before these products were on the market. A companion letter also includes a request for the FDA to turn over records to my office so that San Francisco can independently determine if we need to take legal action if the agency fails to undertake the required public health review. Second, we can't just wait on the FDA to act. So in coordination and partnership with Supervisor Shimon Walton, and I want to thank him for his leadership and vision on this issue, we are introducing today groundbreaking legislation at the Board of Supervisors that would prohibit the sale in San Francisco of any e-cigarette that has not undergone FDA pre-market review. Under this legislation, any e-cigarette that is required to have but has not received FDA pre-market review could not be sold at a store in San Francisco or bought online and shipped to a San Francisco address. This is not an outright ban on e-cigarettes. It's a prohibition against any e-cigarettes that haven't been reviewed by the FDA to confirm that they are appropriate for the protection of public health. So far, no e-cigarettes have been put through the review process that is required by law. This is a prudent step to ensure that we know the health and safety implications of products being sold here. If the FDA hasn't approved it and reviewed it, it shouldn't be sold in San Francisco. Third, on a more local level, we are introducing a separate piece of legislation today, again in coordination with Supervisor Walton, to ensure that we never have another situation like Juul Labs on San Francisco's waterfront or elsewhere on San Francisco property. This legislation would prohibit the sale, manufacture, and distribution of all tobacco products, including e-cigarettes, on city property in San Francisco, including port property. Fourth, my office, as part of our review of Juul's operations, this morning sent notice to Juul and the Pier 70 developer seeking an explanation for why Juul holds a tobacco distributor license at that property when it has maintained that it does not engage in the sale of cigarette or tobacco products on the premises. San Francisco has never been afraid to lead, and we're certainly not afraid to do so when the health and lives of our children are on the line. And with that, I'd like to turn it over to Supervisor Walton, who has been a fearless partner and visionary leader, both when he was on the school board and now on protecting our city's youth. Supervisor Walton.
First, I just want to thank City Attorney Herrera for his fierce leadership on this. I am really sick and tired of the predatory practices for our young people, where people are trying to set them up for bad habits for a lifetime. This has to stop, and e-cigarettes are contributing to that. When we passed Prop 10 in 1998, which was the tobacco tax, and we wanted the resources to go out to educate young people, to educate communities about preventing tobacco use, preventing nicotine addiction, and we showed record numbers that we were able to do that and accomplish that. And now we have more predatory practices going after our young people, and this, again, has to stop. So I want to thank the city attorney for his leadership on this. As you know, we're going to be announcing legislation at this afternoon's meeting. You've heard a lot of the data in terms of the changes and shifts from weaning people off tobacco to now having more and more young people using tobacco and nicotine products. And I just want to say this, that e-cigarettes have been targeting our young people with their colors and their flavors and enticing our adolescents. And this is predatorily pulling them towards nicotine addiction. In fact, we have people addicted to nicotine who would have never smoked a cigarette had it not been for the attractive products that target our young people. So we can see and understand why it's so important to make sure that if things are not approved by the FDA, if products have not been given the stamp of approval by the government, then we know that they're not safe. And until the FDA does that, we have to make sure that these products are not sold in our stores here in San Francisco. The city has already enacted ordinance number 140-17, prohibiting retail establishments from selling flavored tobacco products. E-cigarettes are flavored nicotine products. Nicotine is what addicts all of our young people and addicts everyone. It is the addictive chemical in tobacco. So therefore, nicotine and the effects of nicotine is what we have to combat as well. So until the FDA rules on approval of marketing of e-cigarettes, we need to make sure that we prohibit all of these sales for anyone under the age of 21 and anyone anywhere here in the city. And we need to make sure that we have a ban on selling products, vaping products, on any city property here in San Francisco. What Juul is doing is irresponsible. They have claimed to be not part of the tobacco industry. I met with them with a concerned resident a few months back, and they swore up and down that they were not connected to the tobacco industry. And then about a week and a half later, they merged with a tobacco company. Therefore, not only are they not truthful, but they are irresponsibly focused and working to addict young people on nicotine products so they will be longtime users of nicotine products to make a profit and harm their health. And we cannot stand for that. We won't stand for that. And that's why we're going to fight hard in San Francisco to avoid these predatory practices for our young people. I want to thank you all for coming out, thank the city attorney, and we will combat this addiction towards our young people. Thank you.
Thank you, Supervisor Walton. I'd like to ask our new Director of the Department of Public Health, Dr. Grant Colfax, to say a few words as well.
Well, thank you. I just want to reiterate that this is a major step forward for public health in San Francisco, continuing the leadership that San Francisco has historically shown in addressing major public health issues. I want to really offer my gratitude to City Attorney Herrera and Supervisor Walton for their leadership on this issue. We know, as has been reiterated in the remarks today, that nicotine addiction is damaging. Nicotine has negative effects on youth's brains, and we are, through e-cigarette use, the industry is addicting a whole new generation of youth to nicotine. And again, we know that nicotine through delivery of tobacco systems is the greatest cause of preventable deaths in this country. E-cigarettes are responsible for the increasing levels of tobacco use we are now seeing again in youth. And we know that we need to do better. We need to turn this epidemic around. E-cigarettes are a gateway drug to tobacco use, and that has been shown repeatedly in numerous studies. So we are here not only addressing the negative effects of being addicted to a substance, the direct effects of nicotine on the developing brain of youth, but also taking a major step in preventing that gateway from e-cigarette addiction to tobacco use and tobacco addiction. This is going to save hundreds, if not thousands, of lives in San Francisco, and is a major step forward in breaking this epidemic. So again, I'm grateful from the health department's perspective. This is a move in the right direction, a major policy advance, and the health department is very supportive of it. Thank you.
Thank you, Dr. Colfax. And with that, we're happy to take any questions that anybody has. How are you?
Good. So what happens to those establishments that already have the products on the shelf? Are they supposed to take them down eventually, or give us a date? And what's the logistics?
We have to go through the legislative process, and I have every confidence that Supervisor Walton will shepherd this legislation through as quickly and efficiently as possible. And once that legislation passes and works through the legislative process, we'll see the final, what the final product is. But yeah, then until such time as the FDA gave its pre-market review and approval, there would not be allowed in either a hard brick and mortar store the sale, distribution, manufacture of e-cigarettes, and you wouldn't be able to send it to an address here in San Francisco online until such time as one or the other products had received its pre-market review by the FDA.
So timeline? So when these things usually happen, 2 months, 6 months?
It's going to be introduced today, and so we're going to be working hard with my colleagues, of course, to make sure this becomes law. When it does become law, it'll take effect 30 days after the legislation is finalized and complete. So with that said, we'll be working hard to move as fast as possible. I can give you a better answer and response probably in a couple of weeks.
Why do you all think that the federal government has given a pass to e-cigarette producers so far? And I guess, what do you think the power is of so-called strength in numbers? New York, you said, Chicago, San Francisco, all pleading with the FDA to start cracking down on this.
Well, I would say, you know, I can't answer for the FDA. I think it's pretty darn inexplicable that they have failed to act. If you think about it, the Tobacco Control Act was passed in 2009. In 2016, the FDA said that these products were subject to FDA jurisdiction, yet they said that they didn't have to first file their pre-market review until 2018. Then they extended that to 2022. In the meantime, we've known that e-cigarettes, which have hit the market really pretty much about 2007, we're potentially talking about 15 years of this being on the marketplace with no pre-market review for a product that we know is addicting our kids, a whole nother generation of kids, to a deleterious drug that is threatening public health and safety. And it is inexplicable to me and inexcusable to me that the FDA has failed to act. And the fact that we got Chicago and New York to sign this letter in no time should be a message to the federal government that municipalities and localities are not going to tolerate this, and that we're going to act as quickly as we can to protect our young people. And I have absolutely no doubt that as a result of today's action, both that letter and this legislation, you will see other jurisdictions step up to demand action from the federal government. If we can't expect that the FDA is going to protect the health and safety of our young people, then I don't know what the function of the FDA really is. So hopefully they're going to get the message.
Just in terms of the second legislation, targeting Juul specifically,
Yeah.
Does this mean, would it kind of grandfather them in but keep them from expanding? Are they going to continue to be able to do what they do there, or what's going on?
Yeah, good question. Under the terms of they have a sublease down at the port. And they have said that they are not manufacturing, distributing, doing anything through that facility. At this point, we don't have any evidence that they are in violation of the terms of their lease agreement. But that's why I sent the inspection demand to them, because it seems somewhat curious to me that they have a distributor's license when they say they're not doing any distributing, manufacturing, or sale on property. So if I find that they are in violation, then I would take action against them for breaking the terms of their lease. But the legislation that Supervisor Walton is championing with respect to what is occurring on port property will ensure that we will never have a similar circumstance of where we have a company like this operating on city property.
And I do real quick just want to say that this should be a message to Juul and any other company or corporation that thinks that they can come into San Francisco and operate in accordance that is against our values here as a city. And so this legislation is going to be focused, of course, on making sure this never happens again on any city property, but it's also a warning to Juul. It's also a statement to Juul that we don't want them here. We don't want them in our city. And so we're going to be fighting to make sure that we figure out and learn if there's anything that they're doing that is not in accordance with San Francisco laws and regulations.
So would you eventually want to see Juul leave the city?
I don't eventually want to see Juul leave the city. I would like for them to have been gone yesterday. And we've been clear about that. Our neighbors have been clear about that. And so we definitely would like for them to conduct business somewhere else.
So, excuse me, when the city signed a contract with Juul, did they not know what the company did, or why did they enter into a contract with the company?
Well, the city didn't enter into basically there's a master lease developer down at Pier 70, and that had a lease with another tenant. And as part of that, there was a sublease that was negotiated between Juul and that tenant. And under the terms of the agreement that we had with the master developer, there were certain rights that were given up by the city unless there was certain milestones and square footage that were hit. So we didn't know about it and weren't aware of it at the time. But I think that it has been a real lesson learned about how it is that the city engages with master developers. And I can assure you, and I'm sure Supervisor Walton will as well, that this is a circumstance that will not happen again.
So the city had no veto power or oversight over
At the
that?
time, no. Any other questions? Thank you very much.